Hello friends, are you someone who is suffering from synkinesis and you are experiencing this weird thing that whenever you close your eyes, try to raise your eyebrows, smile, there is some weird sound or rumbling happening inside your ear, or else you feel pain in the backside of the ear? Then you might be suffering from something called as stepedial synkinesis. What exactly is this stepedial synkinesis? To whom it will happen? And how to manage this? We are going to discuss all of that in this video. So make sure to watch this video till the end. Let's begin. Friends, if you are hearing this word called as synkinesis for the first time, let me explain you what exactly synkinesis so that you can understand this video in a better sense. Well, synkinesis is a secondary complication of Bell's palsy. Bell's palsy is a condition where your facial nerve gets impacted due to inflammation or infection or a tumor based damage. In all of these scenarios, your one side of the face will get paralyzed, and as the time passes, your paralysis will get better, you will recover. But in this process, sometimes your facial nerve miswires and your brain also forgets the right pattern of movement, leading to this complication called as synkinesis, due to which whenever you make facial expression, you see some involuntary contraction on the facial muscles. For example, whenever you try to raise your eyes, there is some movement felt around the cheeks. Whenever you try to close your eyes, there is a movement felt around the cheeks. Whenever you smile, there is a movement felt around the eyes. Now, synkinesis can happen of multiple types. One is oro-ocular synkinesis, which means all the mouth movement leads to synkinesis around the eyes. There is something called as oculo-oral synkinesis, where eye movement triggers synkinesis around the mouth. Then is a mixed synkinesis, where movements lead to contraction in different parts of the face. And one very rare but unique kind of synkinesis is called as stepedial synkinesis, where there is an involvement of a nerve called as nerve to stapedius. Now this nerve is a branch of the facial nerve that leaves the course inside the ear. Now this nerve is responsible for your hearing sensation, is involved in your balance sense, and also gets impacted and involved sometimes. And when it gets involved, it impacts your vision, it impacts your vestibular system, giving you this tinnitus kind of symptom called as rumbling sound or trigger sounds whenever you make facial movements. And that's what is stepedial synkinesis that very few people do experience. But it's very annoying because every time you move a face, you feel or hear some sound, some rumbling inside the ear. So how do we manage this? Well, the management of stepedial synkinesis is also very similar to the management of synkinesis of other areas, where there are three important things. Number one, we need to relax the nerve. We need to relax the brain by doing breathing practices, facial relaxation practices, and relaxation especially on the auricular muscle, which is the muscle on the back of the ear, the upper part of the ear and in front of the ear. This muscle usually gets involved, tensed and tight, and give this synkinetic symptoms. The reason why this helps is because when you relax the muscle, the overcontraction suppresses, which less triggers the nerve and give you less symptoms. The second thing that needs to be done is to inhibit the facial contractions and the contraction on the nerve to stapedius. How to do it is by calming down and reducing the intensity of the exercises and doing the exercise in the most gentlest form as possible. That reduces the force that's falling on the nerve and helps you to recover. And last but not the least is the retraining, where you train your facial movements in a way where you are not the synkinetic symptoms to appear. Now this is very tricky to do, but with right kind of rehab definitely can be achieved. Here the aim is not to strengthen the facial muscles, but to retrain the brain to send the right signals at the right nerve, because right now the brain is sending signals but they are just spreading in different wrong location, which needs to be inhibited first. So the first thing that you have to do is stop squeezing your muscle, stop forcing your muscles whenever you move. I see this mistake made by so many patients. Whenever I ask them to raise the eyebrows or do any facial movements, they start jumping their muscle, and this triggers and increases the synkinesis. Remember, the more force you are going to apply on your muscle, the more stronger the synkinesis will become. Here you need to calm down your muscle, you need to reduce the intensity and the force on your facial muscle so that your facial muscles can settle and relearn and retrain your movements. Just try doing your facial movement just by 5, 8, max by 10%. This way you will learn more control, because the more controlled movements you are able to do, the more controlled expressions you can work on. And number 3, have this habit of doing subtle facial expression. Shift your focus of communication from your face to your body gestures through your hand movements, so that you can be more socially comfortable and can make better communication practices. This way you will be able to reduce the force and the irritation of the nerve and will be able to reduce the synkinesis. Well, this is very easy to say than to do, and that's why working with a facial rehabilitation therapist who have a very good amount of experience and knowledge in the space of facial rehabilitation is the key for better recovery. So if you are someone who is looking for a facial rehabilitation protocol, then we at HealthQ Rehab has a team of therapists and experts with good amount of experience in dealing with different stages of Bell's palsy and synkinesis. We don't use any medication, we don't recommend any kind of magic cure, we just use an evidence-based protocol which incorporates PNF, neuromuscular retraining, mind therapy, etc. to help you to retrain your facial muscles. So what are you waiting for? Go ahead and book your consultation and get yourself evaluated first, because evaluation is the first step to know where you are at your Bell's palsy and synkinesis level, and from there you can start taking the right steps to retrain your facial muscles. On that note, I'll end this video here and I'll see you in another video. Thank you.